Regan Ackerman is with me, and I have to laugh. Okay, just by coincidence, I wanted to run this by you today. Today is National Gobstopper Day. And gobstoppers are like jawbreakers. You remember Willy Wonka and the Chocolate Factory? Okay, they're like jawbreakers. I'm just curious. As a dentist, jawbreakers. I can't imagine how many teeth have been chipped or broken due to a jawbreaker.
They keep us in business. Dentists love them. They keep it. Halloween's coming up, so yeah, eat all the jawbreakers. No, I'm kidding. But yeah, no, that is one thing I'm always telling patients. I'm like, if it's not good for your natural teeth, it's not good for implants. If it can break a natural tooth, it will break these. So, especially my ice chewer. Some people have that habit just chewing ice.
But you can fix them up.
So we can always fix it, yes.
Yeah. And there you go. We kind of leaned into another advantage of Freedom Mini Dental Implants, and that is the fact that you can eat the foods that you love. If you wear dentures, you've probably avoided crisp foods like fresh vegetables and fruits. And you mention this all the time. You say steak.
Yes.
I guess because the amount you have to chew.
Yes, miss eating steak. And like you said, carrots is a big one. Pretzels, crackers. But steak is definitely probably the #1 thing people ask me. Can I eat a steak again? Especially if you have, dentures or you're missing your back teeth, because we replace just, missing teeth as well. It doesn't have to be the whole arch or the whole mouth. So yes, definitely with the mini implants, you'll be able to eat steak again. I just had a patient come in this morning. We just did her recall, and she was like, I had corn on the cob over Labor Day, and it was amazing. So, definitely life-changing as far as what you can eat again.
Yep, not only appearance-wise, but as she said, I mean, things that you love eating, you miss, and they're good for you, by the way. As you know, fruits and vegetables, steak, that's all good for you. Wouldn't it be nice to return to that? Yes, you can do that with Freedom Mini Dental Implants. Okay, we talked about Madonna's procedure, and she had the teeth only. Now, for those who say, you know what, I don't want to do that. I'd like to try to keep my denture. I like the way it fits. Okay, you have a method there, too, right?
Yes, yeah.
Okay.
So we also do what we call a snap-in denture, which is still a great option.
No more glue, right?
Yeah, it gets you out of glue. Because a lot of people, they have dentures, they like the way they look. They just want them to stay in, and they don't want to have to use denture glue anymore. So that's what this method is. It's what we call a snap-in denture. So same thing, imagine this is your mouth, with, without teeth, your gums. I'm going to place the mini implants the exact same way. So no incisions, no stitches, just a little local anesthetic. And the great thing about the mini implant, the same day I place these implants, I will put these attachments inside your denture, and you'll leave that day with the denture now snapped on to those implants. So it stays on secure. You'll wear it 24/7. You'll just snap it out, rinse and clean it, and snap it back in. But then you don't have, to worry about reapplying denture glue all the time. Your denture stays in. You can eat better, and you can sometimes even taste better because you don't have all that glue in your mouth. And sometimes we can even, trim back the roof of the mouth a little bit, like this one is, to help with that gaggy reflex. Sometimes we make new dentures for you, or if you have a denture that you like and it fits, a lot of times we can use your same denture and save you money that way as well. So this is a great option, the snap-in denture.
All righty. Okay, so I'm curious about the free consultation, because we talk about that and it's absolutely free. And if you're wondering, am I a candidate? Now, if you have questions, 571-5263. But this free consultation, what's involved? How long does it take?
Yeah, certainly. So the consultation is usually about a 30-minute appointment. The first thing we'll do is we take a 3D x-ray known as a cone beam. It's no charge because I want the information. I want to know that you're a candidate, and I have all the information available to me when we go over a treatment plan. So you'll come in, we'll take the 3D x-ray, and then I'll come in, introduce myself. We'll talk about your goals, what you're wanting to accomplish. We'll go over a treatment plan, how it works, the process, cost, everything. We do offer financing plans. As far as that regards. But the consultation is no charge whatsoever. So it's definitely worth coming in to see if you're a candidate, see what your options are. I'm the only dentist there, so you'll see me. We're a very small office, so we're not, a big corporate office. You're not going to be a number to us.
Yeah, and to me, I think it's interesting that it's not just throwing away your dentures, although that's an advantage. And there's a no judgment zone here. So if you're saying, I tried my best, I took care of my teeth, that happens. In fact, it happens more often than not.
100%.
Yeah, It's just
many
genetic,
reasons
right?
people are, in a position of losing all their teeth or one tooth. It is definitely a judgment-free zone. So many people, genetics, whatnot, losing all their teeth. It is, we are no judgment whatsoever as far as situation. We just want to help and get you in a position to get you smiling and eating again and confident again.
And perhaps you've had maybe a sports accident, maybe a baseball or maybe a car accident. You've lost a tooth or two, and you can take care of that too. Let's show that model, okay? So, or if you have one of those, they call them flippers, don't they?
Flippers, yes.
Yes. Okay.
I always say if you have one, you know what it is because you probably hate it. So yeah, just like you're saying, if you're missing just one tooth, that sports accident knocked out your front tooth. Some people genetically are even born without a permanent tooth in the front. Or, you have a flipper or a partial, you want to replace it. So place the implant the same way, no incisions, no stitches, just a little local anesthetic. The day I put the implant in, you will get rid of your flipper or partial. We'll put a temporary on there, and you'll only wear it for a couple weeks, and then the nice pretty crown or tooth is made, and that gets cemented permanently onto that implant. So nothing comes in and out anymore. You don't have to worry about flipping a partial or flipper in and out. You can chew and eat with it. And it doesn't have to be just one tooth. I see a lot of people that are, missing their back teeth and they want something to chew with again, or missing multiple teeth, next to each other. Same thing, place the implants. Don't have to do any sinus lifts or bone grafts or anything like that. And then we would have the nice pretty teeth made, and they get cemented on permanently. And you're going to brush them and floss them just like regular teeth. I had one patient tell me it was like she grew her tooth back. It felt like they just grew back. But then you can eat again, and you don't have to worry about a big bulky partial, or, it moving up and down. It's cemented on permanently onto those implants.
All right. Lots of questions coming in. We're going to go to a caller. Kathy, first of all, thank you for watching, and I think you have a question for Dr. Ackerman.
Yes, I do.
All right, go ahead.
Okay, I wanted to know what would happen. You said you cemented up in there. Say you did bite on something and it did break, what would happen?
She said the question was that if she bit on something and it did break, what would happen? How would you fix that?
Yeah, certainly. So it depends. If it's a snap-in denture, usually those are easy to repair. We can do same day or next day repair. She would drop it off and we can repair it. And we do honor a 5-year warranty on everything we do. So if anything were to happen in the first 5 years, we take care of it at no charge for you. If it was a porcelain tooth or things like that, it just depends on the crack, and sometimes we can smooth it off. Sometimes there's ways to repair it. But yeah, certainly if it's a denture, usually that's easy to repair. Even with the porcelain, there are ways to repair it.
Yeah, and they're just as durable as your authentic teeth, right?
Yes.
Okay.
Yeah.
Interesting. All right. If you have a question about you or a loved one, are you a candidate? Any questions whatsoever? 571, you know the number, 5263. 571-5263. Give us a call. We'd love to hear from you. Again, it's Freedom Mini Dental Implants.
We were watching Kevin on TV. We knew that there were some severe thunderstorms headed our way.
That's why we track storms. Chief Meteorologist Kevin.
Superficially, appearance-wise, you look fantastic. It really does take 10 years off of you, as you saw from Madonna. We'll put her pictures back up before and after. But also, ease of speech. No gagging reflex from all the glue or ill-fitting dentures. You hear all of these. There's lots of different complaints about dentures. Wouldn't it be nice to throw them away? And look how nice Madonna looks.
Yes, yeah. So Madonna got the permanent teeth, so no denture. Yes, definitely being able to taste your food, not having a big piece of plastic on the roof of your mouth, not gagging you anymore, like an upper denture can. Some people can't even tolerate that. And, especially on the bottom, to have them cemented in, no more floppy denture. It's not sliding around, not trying to use gobs of glue, and able to wear something. So many people give up on their denture, and they just don't even wear anything. So permanent teeth or even the snap-in denture, so much better than regular dentures. I always tell people, I can make the best regular dentures in the world, without implants, but you're still gonna not, be miserable. You may have to use glue. They're gonna move. They're gonna be hard to eat with. So anything, the snap-in denture or the permanent teeth with implants is a vast improvement over regular dentures.
Dr. Ackerman, if someone's watching now and they said, in the past I went in, they said I didn't have enough bone, so they've kind of given up. They said, I'm one of those people that just doesn't have enough bone. That may no longer be the case, right?
Correct.
Right,
yes.
and probably isn't the case.
Yes, because with the mini implant, it's such a smaller diameter implant. I do not have to have as much bone. So I've seen so many people, they've been missing their teeth for 10, 15 years. They were told they weren't a candidate for the bigger implants, but we take that 3D x-ray and I'm able to tell them, I have a solution for you. We can keep this denture in. You are a candidate for the mini implants, because the mini implant is just a smaller diameter implant. So I don't have to have as much bone, a lot less invasive, no stitches or surgery. So definitely, if you've been struggling for years and didn't think you had any other options, most of the time, I'd say about 90%, 95% of people are candidates for the mini implants. It's pretty rare that I have to tell somebody they don't have enough bone.
Yep, and another big positive, we began our conversation with this, and I think a lot of conversations start with this nowadays, is about budget. And you had said, and it's true, a third to half as much. So you could take off all of that.
Yes.
In Freedom Mini Dental implants, because the other method is more expensive, it is more invasive. So for those who are thinking about a budget, what would you tell them?
Yeah, definitely. I see people that come in with, big treatment plans. Sometimes to do, and I don't want to get, I hate quoting things over, but top, bottom, whole mouth surgical implants, it can get up to $40,000 or $50,000.
Oh.
That's crazy. That's a car.
Ouch.
So yeah, not to say many implants, can't be an investment too, but it's usually about a half or third of the cost. And we do have financing plans. If you qualify, there can be no interest options. So definitely, it's worth looking into and doing the free consultation to see if you're a candidate for it.
So we talked about bone grafts and sinus lifts as well. And so for those who are saying, well, how long will this process take? So what are we talking about here time frame wise?
Yes, certainly. So once you've healed up, the only thing we don't do in our office is the extractions, but we refer to an oral surgeon and work with you. We always say you will never be without teeth. So there is a little, couple months of healing as far as that goes. But as far as the day we place implants, you're either leaving with your denture snapped in that day, or you're leaving with a temporary and getting your permanent teeth, about 4 weeks later, not months later. And everything is done in my office except for the extraction. So a lot of times with the surgical implant, you go to an oral surgeon for the extraction. Then you wait another 4 months. Then you go back to the oral surgeon. They place the implant. You wait another 4 months. Then you go back to your dentist to uncover it. Then you get an abutment. It can be up to a year, 2-year process. So, the mini implant, we're definitely trying to simplify things. Place the implant, I place the implant, and you're either leaving with the denture snapped in that day, or if you're doing permanent teeth, within weeks you have your teeth. So it's not a long, drawn-out process, which is the beauty of the mini implants.
There you go. The news is good. Save time and save money. I think we have Charles. I don't know if I heard correctly. Charles, welcome to the show. You have a question for Dr. Ackerman?
Yes, I do.
Okay, go ahead.
My question is, I have a full set of implants. My upper ones does not come out, and my lower one has the regular implants except for 2 mini implants, and they've never really worked. I cannot bite, and I can only chew on one side. Is there anybody can repair that?
Yeah, so if they're mini implants, sometimes too, the housings or the attachments or what we call the O-rings can wear out. So it may just be that those need to be replaced, especially if you've had them for, a long time. So yeah, definitely I would say, make the consultation and see if, it's just a matter of replacing kind of like some parts or getting your tires changed and your oil changed, because those O-rings, if it's something that snaps in and out, sometimes those wear out. And once we replace those, and it's easy to do, it tightens the denture back up and makes it, a lot, more tight and snug, kind of like when you very first got it. So yeah, especially if many implants are involved, you know, there's definitely a way. A lot of people with the snap-in denture, that is one thing that we go over, is that you have to get your O-rings replaced at least once a year. It's like little rubber gaskets, and they will wear out over time. I call them like tires on a car. And so, you know, the denture will start to get loose, but if you come in and get your O-rings changed out, it takes us maybe 10, 15 minutes, and then you snap that denture back in, and it's tight again, like the first day you got it, and it makes a big difference.
All right, with our final 30 seconds here, age range, youngest patient you've ever had?
16.
All right, and oldest?
90.
Oh, good.
Yes.
So it's never too late to look and feel your very best with Freedom Mini Dental Implants. Free consultation again. Please encourage everyone, give the office a call, make an appointment, right?
Yes. Yeah, we're right across from Valley High School on Dixie Highway. The consultation's no charge. Like I said, we're a small family-owned office. I'm the only dentist there, so you will not be a number to us. A lot of our patients become friends and family.
All right, Dr. Regan.